here's how I've been telling my patients how to floss without making them roll their eyes, but actually open their eyes. Okay, so I'm going to probe your gums, meaning I'm going to check the gum level and the health of your gums. 1 through 3 is healthy, and when I start to see 4s and 5s, that tells me that there's inflammation, basically irritation in the gums. Anything deeper than that tells me that there's something that could be going on. And when I look at your x-rays, I'm checking for bone loss or calculus. And in this case, I don't see any bone loss. Sometimes there can be reduced periodontium, but we can talk about that later. So I don't see bone loss, which is good. This tells me that we're dealing with inflammation. So it's not permanent, it's reversible. Now, if you wonder why your gums are bleeding, that's actually your body doing its job. Your white blood cells are going to the site of infection. Gingivitis literally means gum inflammation. So there's an active infection going on. And those white blood cells are rushing to the area to fight the bacteria. And that's what's causing the bleeding. Now, when we brush our teeth, we're cleaning about 60% of the tooth surfaces, meaning the 40% that we're not brushing is in between our teeth. And that's where the floss comes in. And if plaque stays in those areas, the bacteria builds up, causing more plaque, and some of the bacteria can cause cavities. Other bacteria causes gum inflammation. Some of these bacteria don't like oxygen. They're called anaerobic bacteria, so they love living deep between the teeth, and if floss isn't disrupting them, then they're going to keep on growing. So when I'm doing the cleaning, I can either use a Cavitron or piezo. They both work the same way. So these are going to be using water and vibration to break up and kill the bacteria. Basically, there's little air bubbles going through the ultrasonic. So my job is to reset everything. Your job at home is to keep it healthy. So after the cleaning, your gums are going to be bleeding, and that's normal. So if you brush and floss consistently, the bleeding should stop within 7 to 10 days. That's how we know the infection is calming down. Then I ask them if they have any questions, and I'll also recommend some floss, either cocoa floss or burst or little instruments like this. So why this works? You explain first, you don't accuse them. You're removing you're bleeding because you're not flossing. You're positioning gingivitis as treatable and temporary. You build trust and compliance and give that education to them. Now, I know we don't have a lot of time in the op, but I highly suggest doing this even while you're cleaning and, they have their mouth wide open, so they're still listening.